Hi everyone, I'm Ashani Couchman. I'm a urologist based in South Australia. My specialty is in neuro-urology, so problems with the bladder that result from a neurological problem, which is exactly what we want to talk about here in Parkinson's. I'm not going to spend ages talking about Parkinson's. You already know quite a lot about that. What I will talk about is how Parkinson's can affect your bladder, and how that can impact on your continence, and how important managing that aspect of your life is to ensure that you still feel like you're connecting, communicating and engaging with your friends, family and society as a whole, because there are lots of things that we can do to make that bladder better. So what does or could happen with Parkinson's and, broadly speaking, your continence or your bladder function? Lots of different things. If we think about our muscles and how slow it is to get going sometimes, and the sort of rigidity of the muscles, you can actually have that effect on the pelvic floor and or your sphincter, or the tap that keeps you dry. So one of the common things that patients present with is the inability to empty their bladder properly, because the flow seems like it's slow to get started or stops and starts. Now, it's quite common for that to be related to a sense of urgency, frequency, particularly waking up at night. And that can be really problematic if you think about trying to move fast towards a toilet when you feel that deep and compelling urge to pass water. And losing some of that water is deeply embarrassing and can be very problematic if that's also complicated by risk of wetting through clothes, risk of sitting in one place and not moving, so then your skin gets very damp and wet, no problem. So the other things that can happen with your bladder, apart from your sphincter or your tap being hard to relax, is that your bladder itself could be overactive. And how you might feel that is a sense of urgency or frequency or wetting on the way to the toilet. So you have this sudden compelling urge to pee. Now that's very problematic, particularly if movement is really hard and mobility is a problem. At night, it can be a significant falls risk because you have to get up and move across the room to the ensuite or the toilet down the corridor. So that is an issue that's significant. And if you wetting at home can be a problem, but wetting outside and in company can be an even bigger one. And that can often stop people from getting out and engaging in things that they've previously really enjoyed doing. Rarely, other problems that would normally affect you can affect you as well. So you could leak with coughing or sneezing because the pelvic floor is a little bit more mobile or weaker. Now that can happen particularly for women with Parkinson's, because we have the added risk of pelvic floor relaxation or pelvic floor weakness following childbirth or post-menopause. So in summary, with Parkinson's, you can have trouble holding because the bladder is overactive. You can have trouble peeing because the sphincter may not relax. You can have trouble leaking, either because you can't hold when you want to go, or because you can't hold when you're lifting or coughing or moving. All of those things can contribute to other problems, things like urinary tract infections, problems with your kidney function because your bladder isn't emptying, and ongoing issues with lack of engagement. So what can we do? Well, there's lots and lots of things we can do to help with that. One of the commonest things we can do is use medication to help you hold your bladder. Now, there are some medications we can't use very well in Parkinson's because it can interact with your Parkinson's medication. So things like oxybutynin or solifenacin, commonly used tablets to help you hold, are really not safe or effective in Parkinson's disease. We have newer medication, one called Becmiga or Mirabegron, and that's not on the PBS, but a good way of helping you hold, stopping that bladder from spasming. What's a little bit more difficult to manage is that peeing side. We don't have a tablet to get that sphincter or tap to relax and allow you to pee and empty very well. So normally when we talk about that aspect, we have to either teach you to empty using an external device, and by that I'm coming around about to talk about urinary catheters, which we can either teach you to use intermittently yourself or have in as a permanent thing, either through your water pipe or your urethra or through your tummy. It sounds really confronting when somebody says, "Oh, what about a urethral catheter?" But it can be a deeply freeing act if you're never worried about getting stuck. if you're never worried about taking minutes to pee, how much more comfortable and confident are you going to be getting out and about? If you can control your emptying and you know you empty completely and you're not having to rush to the toilet almost immediately, that can be a deeply liberating thing as well. So don't be afraid of a catheter. Embrace that discussion and see whether it would work for you now or later or in certain circumstances. As a surgeon, it's really hard to talk about managing continence without talking about surgical options. And we have a number that don't require major surgical intervention. We talked a little bit earlier about an overactive bladder. Well, you could talk about Botox, which is an excellent way of stopping that bladder spasming, helping you hold more volume, and also helping you confidently hold when you feel like you want to go. So suddenly your capacity to hold is improved and your ability to hold is improved. There is a small risk that peeing might be slightly compromised with that, but that's something you can discuss in detail with your urologist, and they will be able to help you get through and move on from that. Because I'm a surgeon, I will talk about surgical options, and our surgical options aren't scary. They don't even involve a general anesthetic. They involve a bit of sedation, because I know that cognitive decline can be a really big worry here, and you don't want to be exposed to anesthetic unnecessarily. So if we go back to that urgency piece, so if holding is a problem, Botox can be a great option to help you hold better. It basically stops that bladder muscle from squeezing, so you're able to hold when you want to go. So when you feel like you want to go, you feel confident that you can hold calmly and carefully, get to the toilet in the time that works for you, rather than in the time your bladder is dictating you need to go to the toilet. It can, in some rare circumstances, make your peeing a little bit harder, but that's something you can discuss with your urologist, because there's lots of ways to circumvent that. An alternative therapy we're using more and more is the pacemaker. That's a colloquial term for the sacral neuromodulator. Essentially, it does what it says on the tin. It accesses your bladder nerve supply at what we call the S3 nerve root, which is the nerve root really low down in your sacrum, and using electrical stimulation, change the messaging to the bladder so it can hold better. I suppose the great thing about that is it can sometimes improve your peeing as well. The battery life these days from the two companies that deliver it can be up to 15 years, and you have options of either a rechargeable or non-rechargeable battery. The negative, of course, is that it is a prosthetic, so you are having it inserted. Nothing is outside of skin, but it is something that you need to be aware of and declare. Fundamentally, I think continence is crucial. It's an extremely common thing to go hand in hand with a Parkinson's diagnosis. Your continence will be directly affected by your Parkinson's disease, but it will also be affected by your gender, your other health problems, your overall background, and sometimes your family history. Don't forget that we do need to make sure that no other nasties could be lurking that could be contributory with your continence impairment, which is why it's really good to have a really sound discussion with your neurologist, with your GP, and fundamentally with your continence specialist, be it starting with your Parkinson's nurse, who'll be extremely knowledgeable in this space, your local urologist, your physiotherapist, and certainly your fellow Parkinson sufferers. It's so wonderful to be able to be in a community where you can share that information. So I think the take-home message is Parkinson's can affect your bladder. It can stop you from holding and also stop you from peeing. There are a lot of things that we can do that range from tablets to minimally invasive surgical procedures that can really improve your quality of life, your confidence around your continence, and your bladder control.